Some healthcare workers don't want the COVID-19 vaccine. America's healthcare workers have lived through unspeakable trauma over the last year, putting their lives and those of their families at great risk as they fight a novel viral outbreak. COVID-19 has claimed more than 450,000 American lives, including almost 3,000 healthcare personnel. The development of effective vaccines was always going to be a key turning point in controlling the pandemic and bringing back something resembling normalcy. That has been most true for frontline healthcare workers, who are among those most vulnerable due to their proximity to infected patients. The campaign to immunize healthcare professionals has hit a snag as a notable number of frontline workers decline the vaccine. According to the Centers for Disease Control and Prevention, just 38% of nursing home workers participated in the federally run vaccination campaign for residents and employees of the facilities during its first month. 23% of healthcare workers said they would never accept the vaccine. Among unvaccinated employees, 38% said they feared long-term side effects. Healthcare workers appear somewhat more skeptical compared to the general public. The fact that many healthcare workers are reluctant may seem surprising to lay people. Many assume the reticence is an outgrowth of the anti-vax movement or a sign that the vaccines aren't safe. But the reasons healthcare workers have declined are complicated and disparate. Experts and representatives of healthcare workers and healthcare employers are quick to emphasize that these hesitant workers aren't fools, conspiracy theorists, or anti-vaxxers. In many ways, their worries grew from the peculiar circumstances of the coronavirus pandemic. Some healthcare workers have developed a deep mistrust of their employers and government leaders during the pandemic, after months of fighting for basic needs like masks and other personal protective equipment. They have watched the government bungle so many aspects of the COVID-19 response that when those same authority figures tell them to get vaccinated first, essentially to be guinea pigs for new vaccines, their messages aren't always well received. Some healthcare employers have used financial incentives to encourage workers to participate in the vaccination campaign. Others have mandated vaccinations, but such dictates from their bosses could deepen workers' mistrust, not improve matters. There are concerns about side effects, too, especially among women who are or may become pregnant, because the science is unclear about how the vaccines may affect pregnancies. Healthcare professionals are susceptible to rampant false information about the vaccines just like anyone else, especially those workers who haven't had the kind of advanced medical and scientific training physicians and senior nurses have. The healthcare workforce comprises a large and varied number of jobs, including home health and nursing home aides, hospital orderlies, cleaning staff, security personnel, and more, and many of those jobs require no more education than a high school diploma. Vaccine hesitancy does not mean that our staff are dumb or aren't making good decisions or anything like that, said Mark Parkinson, CEO of the American Healthcare Association, a Washington, D.C.-based industry group for nursing home operators. Parkinson said that there's been a lot of misinformation out there. There are rampant rumors spreading on social media that the vaccine can cause fertility problems, which has caused concerns among many of the young women who work in our facilities. Wearing a face mask may limit exposure to respiratory droplets and large particles and may help prevent people who have COVID-19 from spreading the virus.